Hello, I'm Bo Woods and I'm here with Jen Goldsack. Welcome to our series Hacking COVID-19, co-hosted by the BioHacking Village, Digital Medicine Society, and the Medical Device ISAO. Today we welcome physiotherapist David Dansereau, who will tell us about how he's caring for patients using virtual approaches. David, take it away.
Thank you, Bo. Thank you, Jen. Yeah, thank you all for attending today. I just wanted to give a kind of a brief, where we are, state of what's happening now has put all of us as PT professionals um, in really in a predicament, and what is the best thing to do. Many of us who have been using other ways to connect with our patients outside the clinic walls may have been better prepared for this than those that are now scrambling to figure out what's next. We're all faced with either keeping our doors open under limited conditions if we're able to, or having to shut the doors completely. And I've been fortunate with my connections actually through the Digital Medicine Society and stepping outside my clinic walls to learn about digital health way before this this whole crisis or the whole world really got turned upside down here. That I've been connecting with patients remotely through online home exercise programs, through collecting outcomes measures, and whether it be pain scales, whether it be difficulty of exercises, and deriving that engagement before. So for me, it was just a matter of flipping the light switch. I had all my systems and team in place ready for this. So I know that others aren't, and I know there's a lot of questions around telehealth. So this slide deck was, purely, now everything's coming to light. As I actually recorded, and I'm not going to go through the whole deck, but just a couple of predictions that this was meant to be a 6-part series that actually I started back in early February before everything happened here. But I think the big focus now is on, for us, is the barriers that we've had as PT providers that we're seeing in real time, that we've had some emergency codes that are being passed through, but both by CMS for e-visits and also for certain insurances. And this is not, I'm not the best authority to know obviously what's happening in everyone's individual states, but I know in Rhode Island and Massachusetts, where I have license to practice, there's been emergency codes and ability for us to actually do certain procedures that we would normally do in the clinic virtually. So one of the big barriers that we're facing right now is that we were definitely not ready. Our EHRs and our systems were not ready to engage, and there were a lot of other cues around in other industries that this was actually happening. I do a couple here as examples. We don't have time to go into the detail, but I'd like to just use some time to show, as these trends have changed towards an acceptance of telehealth, and we know in other industries, for example, physicians, and although the adoption up until about a couple of weeks ago was very slow for telehealth, this normal hockey stick curve is now going straight up like a rocket ship, and we are, I think we have, and I was saying as part of pre-call here, that I think we have one chance now to do this right, because what's concerning to me as a practicing PT is that there's a lot of PTs who were not ready and are doing things with not security and patient interest first in mind. They're trying to connect, but there's a concern that if we have one shot, and I mentioned at the beginning, it's almost like someone took that etch-a-sketch of all these disconnected pathways and was trying to make these things connect. And it's like with what's happened, this has been shaken up, and we have the chance to redraw this and do it the right way. So I hope that while your patient waiting rooms are empty, that we rethink the way we're able to connect and do patient first care. And I give you a couple of quick examples here that, in my practice, I'm working with several patients that I have a mixed caseload right now. Most of my Parkinson's patients, for example, are very scared of losing their progress that they've made and worked hard with me over the years. With this condition, many have been with me for many years on my schedule to maintain their mobility. Fear of fall is now something that's foremost in their mind, not knowing and fearing even more at this point for what would happen if they did fall and had to get admitted to the hospital. That's one example where digital tools and connecting to monitoring them at home and just helping them alleviate some of these fears. You know, I have a couple of patients that are in various stages of frozen shoulder, and I've used remote technology. You know, I certainly can't mobilize their joint, but I can, with the help of a spouse or someone in their home, I can actually lead them, and I've done that. I've done 3 sessions already with an assisted stretching protocol using virtual or using tele tools that it's the next best thing right now. And I also have another patient who, you know, is as of right now, there's, you know, all things are go in a smaller community hospital. They're still on the list of whether or not they're going to be able to have their elective hip done. And so we've been doing a lot of our connected back and forth virtual visits going through her Therex. But you know, part of what she's feeling right now is the anxiety of not knowing, is her surgery going to be on? Should she do it? We're watching her blood pressure. One of the things we're working out with the Apple Watch, talking about hacking digital tools, is we've been just using the breath feature on the tool just to say, look, we got to lower your anxiety. And this is one thing that I'm, you know, I have a little whiteboard that I keep, and this is, you know, I go down this list, you know, it's whether, so let me stop showing my screen. Sorry, I meant to show this, guys, that, you know, one of the things, just, we come back to our roots as educators, as physical therapy professionals. There's different, you know, whether you consider yourself a manual therapist, we are a sports physical therapist or neuromuscular. We are all at our roots educators, and that's the best thing we can do during this period of time. So in the case of the patient that's waiting and getting anxious about whether or not she's going to have her surgery, is this, you know, simple things. I kept it very simple, and I use this a lot, is just breathe, hydrate, muscles like water. You got to smile, you got to get outside, and, you know, not outside to connect with people. Although I've seen more people in my neighborhood than I ever knew I had as neighbors lately, and that's not a bad thing. But get away, and when I'm talking about sharing, I'm talking about sharing what's on your mind, sharing, you know, and my patients are actually revealing a lot of things to me about, like that Parkinson's patient, fear of falling, that they might not be sharing with their spouse, but they're telling me, and that's where an e-visit, you know, via phone, or, you know, when we overlay that with some video, I can kind of walk her through, you know, what things she can do, with certainly with safety first, but she can still do in her home to keep her ankle mobile, to keep her, you know, to keep her breathing patterns, you know, and just, you know, we all have to kind of do our best to get through this, but those patients that are most critical definitely need this lifeline right now. And again, then rest, rinse, and repeat is sort of what we're going to have to do every day, because we don't know how long this is going to go on for. So do you guys have any questions, or do you have any?
I have 2, and please field them in whatever order you think is best, David.
Sure.
The first is, you were talking about some of your colleagues who perhaps didn't see this this transfer to sort of more virtual approaches, taking patient care outside of the clinic setting, being caught out a little bit. What advice would you have for them? Maybe we'll start here. What advice would you have for them as they try and keep up and they try and provide, you know, what I think you rightly described as a lifeline to their patients when folks aren't able to get into the clinic?
Yeah, that's a good question, Jen. And I would just say, for right now, just take a breath, pause, and do this right, because in the short term, if you don't have the right tools in place, it's and you jeopardize patient safety right now. This is something that I learned over the course of years, not over the course of days. And if you have a peer or a mentor that can accelerate that process, but put the right security measures in place. Work with a platform that has already figured that out, and then instead of trying to piece together a digital way to send exercises or another way to collect outcomes or intake questions, and then a separate platform. If you have a platform that is doing all that and is prepared to then go to the next level when digital tools are available and can connect, when we can connect a remote sensor, all that data will be coming in the background, and we can get back to more of this. Spending time actually engaging the patient and more actually true FaceTime where we're learning. Because if you get to the root and you ask the right questions, our ultimate goal is to empower the patient to be able to learn how to move their body for the rest of their lives. So if therapists haven't done it already, and there's a lot of misinformation that's going on from some of our governing bodies and even from some of our individual EHR vendors. Reach out to someone. We have a telehealth physical therapy providers group. We went from 2,000 members, of which probably 100 were truly active, to over 9,000, 10,000 literally overnight, and everyone is panicked to try to do this. Think of this long term, not just about over the next month. You'd be better off going pencil, paper, and doing it right and sending people information and going over that, because if you were doing your job up to this point, your patients should already have their home exercise program and some of their tools in place, and you just then need to advance them to the next level of care. But as my screen may still show, you kind of mentioned that the digital health revolution is here. It has definitely arrived now. So if we haven't innovated yet, it's now time to innovate, but use this downtime to get back to building your practice right.
And you beautifully answered my second question, which is where can folks go for resources? And David, I wonder if you can repeat the member organization you said was sort of 2,000 folks strong, or practicing telehealth
Yes,
for therapists.
Yeah, that is telehealth providers group. It's led by Rob Whiting, and he has been in this game just about as long as I have doing telehealth. And our mission with that group is just to do this, to educate and teach other physical therapy providers. So when I mentioned probably off slide here that there were 2 CTAs or call to actions. One was for folks in my profession to join the Digital Medicine Society, and then the other one was to be part of our telehealth providers group. And it's a Facebook group now. There's a digital library of training tools that are available. We're in our second round of, and now that we were in a second round of a challenge to get more PTs involved. But now the difficulty there is that everyone in that group is now actually doing it. So you can post your questions, but you're also welcome to stop by my site at smartmovespt.com, and that can start to lay some foundations for you as well. About you can get the full slide deck here, as well as a digital guidebook that I'm slowly adding content over the next couple of months to help people to understand how to do this.
Fantastic. Bo, did you have any questions?
I didn't. David already answered my questions.
David, this is fantastic. I was in a pretty big car wreck about 2 years ago, and I will say for a period of 8 months, and then after a second round of various surgeries, another sort of 2 or 3 months after that, frankly, my PT visits were sort of my lifeline. It was really important to go and see someone who was really sort of invested in my recovery, and my own sort of micro goals along the way were always to be put on display at my next appointment. And that was such a huge part of my mental recovery as well as my physical recovery. So thank you for the hard work you're doing to keep bringing your skills and that support, which isn't just physical, it's also usually mental, to patients. Thank you for the advice you gave about using secure platforms and continuing to be mindful of things like patient data and safety while still delivering that care, and also for sharing those resources with us. We'll try and put those in the notes with the episode, and your time. I know you're really busy. You have a full patient list and you're doing a lot of mentoring right now. So on behalf of the Digital Medicine Society, on behalf of the BioHacking Village and MedISAO, thank you for taking the time with us. I learned a lot from you, certainly really inspired by the efforts that you and your colleagues are making. Stay safe.
Thank you. You too.